Hello, everybody. Um, this is a seminar series that we're going to do here at the Hulla Research Channel, where I will provide some specific aspects of research involving presentations. The first one here will be over qualitative research, and we'll have another one coming up later in the month, maybe the beginning of April, over power and sampling data. So without any further ado, let's get into the introduction to qualitative research. So as a quick overview for today, I'm going to discuss the key differences between qualitative and quantitative research, the qualitative research process, different qualitative research approaches, a discussion on the best practices to analyze qualitative data, and some software that can be used to help in qualitative analysis. So qualitative research is a method that produces non-numerical data that's descriptive, and this usually comes from observing behavior or documented personal accounts or experiences documentation of personal accounts and experiences. Data is often transcribed in a text format in order to be analyzed. Qualitative data gives the researcher the opportunity to help determine the origin of phenomenon, and it also can help determine if participants' experience result in a pattern or trend that can create a theoretical framework regarding a phenomenon. Though not all qualitative research is done to develop theory, which will later be discussed. Qualitative research can help construct meaning from data, whether it is quantitative or qualitative. So in some instances, qualitative and quantitative research are used together to complement each other to assess data or theory with more rigor. So for example, if we were conducting a focus group on former drug abusers and wanted to look to develop a theory of how their behavior started based on their responses, we could then use our analysis from their responses to help develop theories to test quantitatively. We could then develop a survey, which could be scored numerically, and then send that survey out to hundreds or thousands of participants and see if our results could be generalizable. Sometimes qualitative and quantitative research can complement each other in reverse. So where we were looking at qualitative data to develop quantitative testing methods, we can look at a quantitative phenomenon and try to interpret it with qualitative data. And one example of this could be, let's say we looked and saw, as an employer, we looked at a department where we noticed a lot of people leaving the department. So with the quantitative data suggesting that a lot of people are showing that a lot of people are leaving, we would then want to interview some of the employees in that department to help determine what could be the motivation for the employees leaving, whether that be work environment, pay, superior or supervisor behavior, whatever it may be. But it's important to note that quantitative and qualitative research are both critical to the research process. But to emphasize the importance of qualitative data, I like this quote from Albert Einstein: "Not everything that counts can be counted, and not everything that can be counted counts." So next, we'll discuss some key differences between quantitative and qualitative research. Qualitative and quantitative research are the two primary approaches used in research. Ultimately, the two approaches differ in their methodologies, data collection techniques, and the type of data they generate. Regarding the nature of data, Quantitative research focuses on quantifying relationships and differences using statistical analyses in an effort to find support or not support a hypothesis. And remember, hypotheses are directional in nature. So, for example, if we were wanting to look at sleep in college students, we could say we hypothesize students who live on campus will have better quality sleep than those living off campus. And maybe our reasoning in that is that students that live on campus will have a shorter commute, therefore can sleep in longer, therefore having better quality of sleep. And we could test that hypothesis. Qualitative research, on the other hand, will focus on answering a research question by collecting data through words or observations, aiming to understand meaning through subjective experiences and deriving themes from that data. So a research question for qualitative research is not typically directional and is usually neutral. So, for example, if we're still wanting to look at sleep in college students, we could ask, what are factors college students are experiencing that impact sleep? In terms of research methods, quantitative is more structured and rigid, using surveys and questionnaires that have close-ended questions and forced choices, such as Likert scales that you'll see that will be, you know, answer this question from strongly agree to strongly disagree. Right? That's a Likert scale. Qualitative research methods usually involve semi-structured methods such as interviews, focus groups, and open-ended questions. When using techniques like interviews or focus groups, this allows qualitative research to be more flexible, and emergent during the research process. For example, after a participant answers our research question, like in our last example, what factors are you experiencing as a college student that impact your sleep? They can answer the question, and maybe they talk about noise being an issue. We can then probe that and be, please explain, where, what the generation of noise comes from. Is it your neighbors? Is it, traffic outside? What is it that where is the genesis of the noise coming from? Qualitative research allows for this flexibility where we could probe the participant even farther, where quantitative research doesn't have that privilege. Quantitative research generally seeks to measure objectively and yield results that can be generalized to larger populations, such as an effect of a specific therapy. So you'll see this in drug research where, they'll require large sample sizes, where they'll have participants, take the drug versus the placebo, and then they want to assess if the results of this study can be generalized to the broader population. Qualitative research, on the other hand, this is not always the focus. It's more to explore subjective experiences and attitudes and behaviors within a specific context, aiming to provide more an in-depth understanding rather than broad generalizability. Also, due to the labor-intensive nature of qualitative data collection, usually through long interviews, and the labor involved in the analysis with coding the content, the sample size in qualitative research is generally small in comparison to that of quantitative. So, as mentioned earlier, when it comes to data collection, quantitative research consists of closed-ended surveys and scales, such as Likert scales, objective measurements, such as performance measures like test scores or athletic performance, where qualitative research will use those interviews, focus groups, written material, audio-visual recordings that can be analyzed for themes. So next, we'll discuss the qualitative research process and some of its approaches. So the first step of your qualitative research process should be to identify a topic. Usually, this is based on a phenomenon that you, the researcher, will observe and want to learn more about. When selecting a topic, the researcher should consider whether the topic is useful and what it will add to the existing literature, such as will it be novel? Will it fill in any gaps in the research? So, for example, if our topic was teacher turnover in the post-COVID era, and we want to look at the research that's been done on this topic, and maybe let's say the research that's been done on this has mostly been on the West Coast or in the Northeast. We may be able to fill in the gap of the research and look at how this teacher turnover could be impacted in a state that maybe had a different response to COVID, such as Florida. We could also look at maybe address gaps in population groups that haven't been researched. So maybe all the research has been done on public institutions, and we can address some gaps by looking at some private institutions. So it's important to consider, when you select a topic, how these gaps can be addressed in your research. Once you have identified your topic and looked into the literature, you would want to determine your research question. So if we carry on with the topic of teacher turnover in the post-COVID era, maybe we could develop a research question looking at what are the new difficulties teachers face in the post-COVID era. Some of these approaches to qualitative research include case studies where the researcher will focus on an in-depth analysis of a single individual, group, or event. Ethnography, which would involve the researcher immersing themselves within a specific community. Grounded theory, which involves the qualitative researcher to develop a theory or framework based on the data collected. Narrative research, this involves the collection analysis of stories, life history, personal accounts, and this is usually assessed through analyzing documents such as journals, diaries, recordings. Phenomenology is an approach where the researcher is aiming to explore and understand the lived experience of the participants and not necessarily trying to develop any theory. What we spoke about data collection earlier, here they are again for your reference. So these are common types of ways to collect qualitative data. And when it comes to data analysis, you can use software such as NVivo to help in the analysis, or you could always go old school and do it manually. But data analysis usually involves a contextual analysis by creating codes to summarize or condense the data. A thematic analysis is common to perform, and this is where themes will be derived from codes from the qualitative data. This process can be done, like I said, manually or with the assistance of software. And finally, the ultimate goal of your research is to report your results in a way that the readers can understand the patterns you did or did not find. So, reminder, not all qualitative studies generate a theory to explain a phenomenon, but those that do will need to aim to have their results tie into their theory development. Next, we will discuss the three most common approaches that I run into helping people with their qualitative research, and this is case study, grounded theory, and phenomenology. So a case study involves a thorough examination of an individual event or phenomenon through various forms of data collection to comprehend the case context and connections. It's not typically generalizable due to a small samples, but that does not mean the findings are not impactful. Cases often can involve rare medical issues, rare behavioral issues. So a great example of a case study is the investigation into Phineas Gage. Gage was a railroad worker who was involved in an accidental explosion that sent an iron rod through his skull, damaging part of his brain. Remarkably, Gage survived the injury and physically recovered, but his personality and behavior had noticeable changes. Dr. Harlow was the individual that uh, did the case study on Phineas Gage, and he noted that before the accident, Gage was responsible, hardworking, and dependable, as noted by his friends and family and coworkers. However, following the injury, um, it was described that even though Gage had no issues with memory, cognition, physical abilities, Gage's once gentle personality slowly degraded, as Dr. Harlow described, into a disrespectful to being disrespectful to colleagues, unable to accept advice, acting without consequences, and overall just becoming very impulsive and profane. He noted that Gage was no longer able to hold down a job or maintain uh, relationships due to his altered behavior. And those that did know Gage before the accident said that Gage is just no longer himself. The case study provided significant evidence that specific brain regions, especially the frontal lobe, play crucial roles in regulating personality, decision making, and social behavior. And this could later be further investigated in other TBIs. So the next approach we'll discuss is grounded theory. And grounded theory research uses a systematic analysis of qualitative data to be organized into codes and themes. The analysis is aimed at using induction to form a theory that explains observed phenomenon. In specific contexts, specific contexts, these theories can be extrapolated to generalize beliefs. Data is most often collected through interviews and requires numerous points to see data patterns. This could result in longer data collection versus other qualitative methods because the researcher needs to hit a point of saturation where they collect enough information to develop their theory. In a grounded theory approach, the researcher is expected to have existing knowledge of the topic through a rigorous literature review. They should know about other theories involved in the topic they're examining. This could create some bias concerns, given that if a researcher ignores previous theories that do not support their own when analyzing the data, that could definitely bias the results of the study, or the researcher could always run into unintentionally loading questions, interview questions in a manner that induces a participant to answer the question in the way that supports their theory. This can often occur without any intention. The best approach is to consider pre-existing theories in the literature, but limit their influence during the research process. So an example of grounded theory qualitative research was done by Glaser and Strauss. They, in fact, did the first study that used this technique. And what they were doing was exploring the experiences of terminally ill individuals and healthcare professionals in dealing with dying patients. And they did this by comparing patients and hospital workers that were in geriatrics or oncology clinics, where it's much more likely for patients to be terminally diagnosed with the terminal illness, versus patients that died suddenly in the ER or pediatric clinic. The researchers conducted in-depth interviews and observations in the hospital, aiming to understand how people face terminal illness, perceive and cope with their impending death. What they found was that the patients that were diagnosed with a terminal illness started to experience stages of awareness. And this started off with initial shock of the diagnosis to the eventual acceptance and coming to terms with their impending death. Patients also started to engage in different coping mechanisms. So they noticed that patients would handle their awareness of dying by engaging in denial, seeking information, seeking social support. And they noticed that changes in interaction with healthcare providers were present. Healthcare providers started communicating with patients differently once they were diagnosed with terminal illness. Specifically, they noticed that healthcare professionals would respond. Uh, they would respond quicker and more likely to respond to the patient when they were diagnosed with with a terminal illness. In the study, they also looked at the impact of the institutional setting, such as a hospital, on the experience of dying and how it could impact the quality of care. So next, we'll look at phenomenology. And as a research approach, this design emphasizes the understanding and exploring of subjective experiences and perceptions of an individual in a specific context or experience of phenomenon. The researcher wants to focus on participants that have a common experience. The data is often collected through interviews and observations and requires neutral questioning. So it's important to engage in what something called bracketing. And basically, this just is the awareness that any preconceived assumptions the researcher may have or prior theories they may be aware of regarding the phenomenon they're looking at doesn't impact their research process, doesn't impact how they develop their questions or analysis. And they need to be very certain to make sure the participant tells their story of the phenomenon and not engage in any questions that may derive from theory. So in all, the studied results can be used to compare to prior research and see if it could support or not support prior research, or find something new. Participants must be those who have experienced the phenomenon, and this is not always black and white. It could require some discernment from researchers. So, for example, if we were examining people that were involved in a natural disaster, such as a hurricane, and we wanted to study the impact of that natural disaster on a community. The people that experienced the eye of the storm may have quite a different perception of the natural disaster than those that just were hit by the outskirts of the storm. So the researcher must discern who qualifies as somebody to interview for this study. Do we want to know everybody's experience, whether they just, had some, light flooding, or do we want to see people's experience that, were involved in the eye of the storm and felt, 70-mile-an-hour winds? That's up to the researcher to decide. One famous example of phenomenology, the phenomenology approach, was the study of, and I'm probably going to butcher the pronunciation of this, the Minamata disease, which was a neurological syndrome caused by severe mercury poisoning. The disease resulted from a industrial chemical company that was discharging their waste into the Minamata Bay. The pollution led to the contamination of fish and shellfish in the bay, and when local residents consumed the contaminated seafood, they started developing severe symptoms, including neurological impairments like muscle weakness, loss of sensation, difficulty speaking and swallowing, and uncoordinated limb function, and in even severe cases, paralysis and death. What medical professionals did is they conducted in-depth interviews and engaged with individuals who are affected by Minamata disease to understand their experiences, how the symptoms impacted them on their daily life activities, and ultimately to examine the nature and progression of the disease. So, when to use what approach? We already went into detail regarding phenomenology, grounded theory, and case studies. Narrative research and ethnography are less common in the fields I generally work with, but narrative is not uncommon in fields such as history or humanities, while ethnography would be more common in fields like anthropology or cultural studies. And, just to go into a little bit more detail, excuse me, on narrative research and ethnography, narrative research involves the analysis of content from stories, life histories, personal accounts, usually derived from documents like diaries, journals, letters, and audiovisual recordings. Ethnography entails the immersion of the researcher into a specific community by spending an extended period within that setting to observe, participate, and interview individuals to better understand the norms, practices, and social behaviors of that specific culture. So, I want to talk about some issues with open-ended response questions. So, selection bias is a great risk that can occur in open-ended response research questions, and this is because the interviewer just is not present when this is asked. So open-ended responses are typically questions that may be in a survey where we ask the participant, please describe conflicts that you have regarding your school and health, right? Without the interviewer there, the participant will likely not be very motivated to answer the question thoughtfully or at all. And also, there's always the chance that the participant may not understand the question or may be uncertain regarding aspects of the question, and the researcher cannot be there to provide clarity. Also, these are open-ended responses are often given out through internet surveys, and internet users in particularly will tend to read and answer survey items quickly. Quantitative researchers can reduce this bias from implementing attention checks, but qualitative researchers unfortunately don't have the same privilege. Open-ended responses overall, they can potentially contribute to just less thoughtful responses from the participant, short responses, often making the answers vague, overly broad, or too short to code for the researcher. Additionally, a significant amount of missing data may occur in open-ended responses, which is not uncommon for people to just skip these questions because they take too much effort to answer, and this can further complicate your analyses. So, when may open-ended response questions be appropriate? Well, in a specific research method, a mixed method approach that uses an embedded design, open-ended response questions could be appropriate. So, for example, if we were doing an experiment looking at factors of employment that may impact working college students' academics and health, researchers may administer a work satisfaction scale, reported study hours, and sleep quality for their quantitative measures. But to enhance their interpretation of this data, researchers may add an open-ended question in the survey about the specific conflicts students experience between work and school. This may help to better inform the researchers of their overall results. The other form uh, of mixed method embedded research design is the qualitative methodology that uses quantitative data to help support the findings. This approach may be used in like user experience research, where researchers gather most of their data from interviewing participants on their experience using a product, but they'll also collect some quantitative measures such as blood pressure, heart rate, and eye movement to examine if the quantitative data supports the qualitative findings. The strength to a mixed method approach is the use of both the quantitative and qualitative components to complement each other in order to have greater understanding of the results. But there are some limitations of the mixed method embedded design. Specifically, it may be difficult to interpret results of the two methods if they are used to answer different research questions. Also, it could be a problem if the findings of the quantitative and qualitative do not complement each other. So this is something to be considered when picking your research design. So next we'll discuss qualitative data analysis. So the popular method to analyze qualitative data is the in vivo coding method, not to be confused with the in vivo software. This allows researchers to find potential degrees of causality or predictability in themes, which can facilitate the meaning of the qualitative data. Open coding is the first level of coding, where researchers will independently identify broad, distinct domains for data organization. The stage will typically use a lot of memos and notes for the data. The second level of coding is axial coding, which is the process of refining the broad thematic domains into refined emergent categories. Memos, notes in this stage are generally used to develop new codes, separate codes, and start making theoretical connections between categories or themes. Selective coding is the third level of coding, and it involves collapsing or reducing the number of categories into more cohesive expressions known as themes. This results in a reduction of the categories from axial coding. Memos, notes in this stage are used to identify relationships for higher level analysis. So a quick example of how this coding process may work is, let's say we were investigating the recent daily routines of individuals who experienced an employment layoff. And one of our questions was, how has their daily routine been impacted? Well, for open coding, let's say we identified a broad domain of morning behaviors. Axial coding of these behaviors included difficulties getting out of bed, mindless scrolling on one's phone, difficulty in starting their self-care routines, negative feelings about their day, contemplating the dread of applying for new jobs. In the next step, the selective coding process, we maybe would just collapse all these codes that I just mentioned into one theme, such as depression. What's really important to consider in your qualitative data analysis is your rigor and trustworthiness of your process, especially if you're aiming to have your qualitative research be published in a high impact journal. You'll need to demonstrate rigor and trustworthiness in your research. Rigor is mainly concerned with the accuracy, especially in coding. Trustworthiness refers to the neutrality when going through the research process, such as having unbiased questions and unbiased coding. In order to ensure rigor and trustworthiness of your analysis, inter-rater reliability needs to be assessed. What that is, it's the degree of agreement or consistency between two or more coders when the two coders are coding independently on the same qualitative data set. To assess inter-rater reliability between coders, the calculation of a intra-class coefficient, also known as a ICC, needs to be conducted. For good reliability, the ICC needs to be 0.75 or higher. If the ICC is less than 0.75, the rater needs to consult and reassess their coding and then recode and reanalyze. Also, for inter-rater reliability, you'll see some people, some researchers will deem it appropriate that the coders only need to code about 20% of the data in order to start calculating inter-rater reliability. I'm always more cautious and conservative than that. I think that the coders probably should be looking at more than 20% of the data. So that's just something to keep note, that it also will depend on the reviewer of the research. Some reviewers may be okay with 20% of the data being looked at for inter-rater reliability, while others may want a much greater percentage looked at. And last, we'll talk about like the in vivo software that can be used. In vivo is a common software that can be used to help with qualitative data analysis. But your data must be transcribed into text format. Software can make organizing text encoding easier. And it even can transcribe your audio files or audio-visual files with 90% accuracy, according to them. The software can perform text searches and provide word counts, frequency counts, or synonyms of the word frequencies counts. And it can provide some cool visualizations such as word clouds and word trees. In vivo can also import the data into SPSS. And there's some references for, where I gathered the information I used for this presentation. And if you have any questions, please comment below. You can always reach out to me and my brother, who was not here for this video, at info@helloresearch.com. And don't forget, if you have any questions that you would like answered, you can always also connect with me on Connect in the link down below. Thank y'all so much for listening to this seminar, and I hope you have a great rest of the day or night, wherever you may be, in whatever time zone you may be in.